Okay, good morning. This morning's gonna be very different than usual. I wasn't really going to touch on the affidavits that JP had put out because really it's just lies time 128. However, after watching Agatha May last night, she had brought up, or it was brought up in the show, part of the affidavit, were text messages that I don't even know who they were between. There was a Derek mentioned in the text messages. And it mentioned something about thyroid testing. Now that's my jam. When I went to school over 25 years ago, part of my studies was endocrinology and hematology, alongside many others. And hematology is the study of blood, and then endocrinology is the study of hormones that are in the body, related to the glands, the endocrine system that regulates them. Now, those are made up of the hypothalamus, the pituitary gland, the thyroid gland, the parathyroid glands, adrenal gland, pineal gland, the pancreas, ovaries, and testes. These are very important. They regulate heart rate, breathing, digestion, body temperature, brain development, mental activity, skin and bone maintenance, and fertility. Now, it's been known that the trauma of surgery alongside anesthesia, and then you add to that pain meds that usually come after to control the pain, you can have a post-operative hypothyroidism that comes out of dormancy. And usually that comes from people who have in their genetics autoimmune or thyroid metabolic issues in the family. Now, I do know that the mother, please ignore my cat, I don't know why he has to meow right now. Now, I do know her mother does have an autoimmune condition. I'm not going to discuss what it is, but I'll tell you what, the possibility of it being dormant in Micah at the time of surgery is very likely now, especially looking into this. Now, my question is, that conversation between this Derek person and whoever it was back in 2022. Were there any thyroid metabolic blood tests done, and what did they say? See, the problem with that is a psychiatrist is not going to run those tests. Insurance is not going to cover it. The only time insurance is going to cover it is if either the primary care physician did an actual TSH, which was a thyroid stimulating hormone test. They could also do the free T3 and T4, but that's as far as it goes for the primary care physician, even if they're internists. Usually a full profile is done by an endocrinologist. And the full profile will have, for example, an ESR, which measures the inflammation inside the body, or a thyroid peroxidase blood test to see if there is actually a metabolic issue going on with the thyroid. And on top of that, normally they don't just take one test and go alongside that. They'll test a patient maybe 2 or 3 times to make sure, because most times the first time that a thyroid is tested may come out with a false negative, okay? So it's always, an endocrinologist will look at the symptomology, or even the internist or the primary care physician will look at that and go, well, let's test your thyroid. If it comes back negative, come back next month, we'll test it again. And once again, if it comes back negative, okay, we'll test it again to make sure, because there have been times where the patient initially is not tested positive for it, and you really just have to test it, especially if the symptomology is very high. And that would have been the best time to have tested her. Now, with that being said, let's look at the symptoms of someone who would have a hypothyroidism issue or even a thyroid problem. Okay? Now, they will have had fatigue, they'd be lethargic, they'd be irritable, they'd have weight gain. That's for the hypo. Hyper would have weight loss. They'd be sluggish, sleep problems, cognitive problems. That means problems with thinking. Inner trembling. They could be trembling. That happens for both hypo and hyper. Vertigo, loss of balance. Vocal problems. There could be a hoarseness that all of a sudden happens with the vocals, or it could lower in pitch. Fluid retention, GI problems, which is gastro problems, okay? Trying to be simplified here. Intestinal, gastrointestinal. So it could be your tummy, it could be your intestines, it could go down to the iliac, all of it, all the way down, okay? Hearing issues, there could be joint problems, there could be skin, hair, and nail issues and loss, there could be vision problems, there could be depression and anxiety, sexual dysfunction, which means the lower libido, and fertility problems. Mind you, all of this information comes from the National Library of Medicine, Mayo Clinic, and Cleveland Clinic. Okay. Now, usually you will see in hyper the same mood swings, but there'll be nervousness, there'll be panic attacks, there'll be insomnia, there'll be hyperactivity, there'll be irritability, there'll be weight loss and tremors. You'll see a protrusion of the eyes, anxiety, low libido, and difficulty concentration. So you could see the symptoms are almost the same, almost. Now, as I don't know if I said this already, but this is notorious for being misdiagnosed. Hypothyroidism. It's notorious. And usually it's for emotional issues, depression, anxiety, and believe it or not, bipolar disorder. Constantly mistaken. Now, let's look at what are the symptoms of a manic episode? Because this has been why she has been put into the hospital. Okay. Tell me if this doesn't sound familiar to you, though, as I read them. Not for Micah either. They can go from being very joyful and very happy to a sudden anger and hostility. Their energy could be full. They could have goal-directed activity, kind of, full energy. They need very little sleep, sometimes none at all. Speech is very rapid, flighty in ideas, excessive rapid thoughts that are hard to follow. Speech very quickly. Now let's stop there for a second. If you listen to Micah's 911 call versus JP's 911 calls, in Micah's calls, this is in the hospital and otherwise, her emotions are very steady. Her speech is very steady, and she's very factual. She remembers everything. She's not all over the place. She makes sense. Whereas if you listen to JP, his speech is very rapid. His emotions go up and down. Sometimes you can't even understand what he's talking about, especially when you listen to the 911 call with Jesus J. Okay. These people also have behavior that's very jumpy, wired. They make grand plans that are unattainable. They make poor decisions. They'll spend large sums of money. They'll take sexual risks and inappropriate behaviors. Once again, J.P. Miller. They feel very self-important, easily distracted, easily irritated, delusional and illogical thinking. This does not sound like Micah. We've seen Micah in the past couple of months before her death on video. And we've also seen JP. She has no signs of these things, not on medication. Now, if she was going through any kind of emotional distress, it could have been related. It could have very easily been related to a thyroid disorder that was going untreated. Okay. Again, only a doctor, an endocrinologist, can treat that and test it. So I don't know who this Dr. Lin was. Did Dr. Lin test it or have it tested? I don't know. We don't see results. Isn't that funny? Did Waccamaw look to see if it was tested before putting her on all these drugs? We'll talk about that in a second. Now, if somebody is not bipolar and they don't require lithium, what would happen if they take lithium? Well, that would cause diarrhea, tremors, and weight gain. Sound familiar? You could also get toxicity from taking it for a long period of time, which will affect intestinal problems, obviously, neurological problems, and can actually lead to kidney damage. Now, you can test for bipolar. It is done. There is a test that will indicate biomarkers linked to the manic symptoms and can actually identify a bipolar disorder. But first, thyroid disorders and metabolic disorders must be ruled out. Before you start treating a person for a bipolar, you're supposed to rule out a thyroid disorder. And one test does not do it. There's multiple tests. As I said, there's the TSH, there's free T3, T4, there's a thyroid peroxidase, and an ESR. Those should be done, and not just one time. They should be retested a month later, at least, a month later, and then again a month later from that. Now, back in 2022, when this thyroid testing was mentioned, the person he was talking to, they had said that they were changing her meds from 450 milligrams per day, which is high for anybody who doesn't need them, of lithium, to 600 a day, alongside Zyprexa at about 150 milligrams per day. 15 milligrams a day. And then birth control. Mind you, birth control also affects the hormones. Zyprexa balances levels of serotonin and dopamine in the brain and has a very strong sedative effect. If you mix that with lithium, you have increased dizziness, drowsiness, confusion, and difficulty concentrating. Again, if you're put on all these medications and you have a metabolic disorder, you're going to be irritable. You're going to see depression. You're going to see someone who's responding not very well because they're not metabolizing these medications well enough. Now, she's in Waccamaw again in 2024, February. This time, they put her on Seroquel. Seroquel is an antipsychotic which can cause headaches, weight gain, insomnia, dizziness, and drowsiness. They additionally put her on Nicoderm patches daily. Nicoderm, or nicotine rather, opens up the concentration level and increases the concentration level of Seroquel or any other antipsychotic medication that's being taken. So imagine the effect of someone who doesn't need it and then has difficulty metabolizing it because their metabolism is slow. Did anybody check? No, of course not. As far as I can see. See, when you say you've got 350 pages of proof, part of that proof would be diagnostic testing. And since there's diagnostic testing for bipolar and diagnostic testing, which is mentioned in the affidavit for thyroid testing, where is it? You have all this information from Waccamaw. Where's the information from these doctors? Where are the medical tests, the blood tests? Where are they? I think that Micah, post-operative, had a reaction that triggered a dormant condition, or probably autoimmune, that was related to her thyroid, and all the symptoms that she had was from a metabolic disorder that went untreated. And so she was mistreated for psychological issues when there are psychological symptoms to a metabolic disorder like hypo or hyperthyroidism. And so, being that she was allegedly cleared back in February, obviously there wasn't a mental problem. It was probably physical and went untreated. So again, I asked Mr. Miller, where are these lab tests that prove that thyroid problems were ruled out and bipolar was ruled in with proof of these markers, these biomarkers that would have been in a blood test? Because I know for a fact, I have a family member, he's not blood related, but he's a family member who is bipolar, who does take lithium. And guess what? When he goes to the oncologist, because long-term lithium use can also create a leukemia, because it thins the blood, they do a blood test every time he comes in. They always test him. So where are these blood test results to prove that she was bipolar? Just asking, because I find it funny how you don't have it edited in there. Anyhow, as I said, I think from knowing her family history, at least through her mother, and looking at the symptomology, I think that she had a thyroid disorder. And unless there's a blood test to prove otherwise, that's what I believe. So there's that. There's my response to Agatha May's last video and to the treatment. And by the way, do you notice that there are no symptomology attached to any of the diagnoses that Waccamaw gives? They give a diagnosis, but there's no symptomology. I find that questionable too. How'd you come to those conclusions? What were the symptoms? I just find it all very, very odd, very vague. Anyhow, that's it for now. And until something else comes up, which I'm sure it will, I will see you, and God bless.